Welcome everyone to today's webinar, The AI Shift Hospitals Can't Afford to Miss. On behalf of Becker's Healthcare, thank you so much for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a panel discussion. We certainly welcome any comments or questions. You can submit those throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with your audio or video, try refreshing your browser. You can also submit any technical questions to the Q&A box. We are always here to help. With that, we are pleased to welcome our outstanding group of leaders, Niel Oscarson, Director of KLAS Research, Liz Cunningham, Vice President of Digital Solutions of AMN Healthcare, and last but not least, Brendan Stack, Product Manager of AMN Healthcare. Niel, Brendan, and Liz, thank you so much for being here today. I'll turn the floor over to you to get us started.
So much for that, and really appreciate the chance to be here. My name is Niel Oscarson from KLAS Research, as was mentioned, and in my role at KLAS, I get the chance to talk to a lot of healthcare providers about their needs, especially in the HR, nurse, physician, staffing kind of opportunities. And so excited to be here with this great group of panelists to talk about some of the trends in healthcare and maybe even more importantly, the problems that we're trying to solve and how some of these AI and technology trends can help solve those items. So we're going to go through a few of the current trends we're seeing. We're going to talk about AI and around, especially around workforce management, some of the ideas there. Talk about workforce efficiency, and then certainly, as we all know, with any technology growth, there are challenges and considerations that should be taken into account. So we hope to give you a few takeaways on that regard to think about what you should be considering as you move forward with these plans. And then, as was mentioned, we'll have some time to talk about what we all think of the future, where we are today, and hopefully, what's exciting in the future, and then answer some questions from the audience. So that'll be our flow today, and we'll dive in with a couple of thoughts from my perspective. I think it's an interesting time in healthcare, and maybe we could say it's always an interesting time in healthcare. But there's always a few scarce resources in healthcare, and I think some of those have become more acute today. From the perspective of where I sit and some of the problems that I'm trying to help hospitals solve at KLAS, there's real challenges around staffing. Nobody on this call is going to be surprised when we talk about the challenges of staffing today. Coming out of COVID, we said things like, staffing shortages and great resignation. We had a great keynote at our last KLAS event that talked about that this is no longer a shortage. This is our new reality. So we're living in a world where there are challenges around staffing, and we need to think differently, perhaps, about our approach to those challenges. But not only that, there are constraints around the facilities and how we use the facility and how we tie our use of, for example, operating rooms to our use of staff and being more intelligent about that approach. So I think organizations more and more are asking me about some of these items that are listed here. Number one, how do I optimize my staff? So I often think about dealing with workforce shortages in kind of three columns. One is recruitment, bringing more people in the door. We know how challenging that can be when it's a limited resource. Two is retention. How do I retain the staff, nurses, clinicians that I have and give them a better experience? And then the third one is optimization. How do I optimize the group of physicians, clinicians, and other staff that I have? And so I think this top one here is often one of the most often questions that I'm getting asked today. I have covered nurse scheduling at KLAS for about 5 years now, and the questions I'm being asked about scheduling specifically, and this workforce topic goes much broader than scheduling, but just as an example, one of the questions I'm now getting asked is, it's great that I can build a schedule. It's great that it's on a mobile app, and it's great that my nurses can do things like shift swapping. But how can I be more intelligent in my scheduling? How do I optimize my staff. We talk about working at the top of license quite often, but maybe even more importantly is with the numbers that I have, what's the best use of them? If I have limited resource, the worst thing I can do is overschedule, and yet we also know we can't underschedule. So how can we be more intelligent about that piece? That number 2 fits very neatly into this second column that I talked about. I don't want to overstate the case here, but I do think that some of us have taken for granted the resource, that there will always be a nursing resource, and that if there's not, we can use travel nurses or contingent staff. And I think in 2024, heading into 2025, a lot of us are thinking more about how do I reduce my contingent staff spend and instead invest more in my current staff. And so increasing that experience of clinicians and retaining them is really important. Certainly, number 3 will never change. There is a lot of work for us all to do around operational efficiency and cost reduction. It does feel like we are a little better off than we were maybe in 21 and 22 when we saw a lot of margins that were negative. And we're starting to see a little bit of improvement in some of those margins in health systems. But that does not mean that the pressure is off when it comes to being more efficient and reducing cost. And frankly, especially with the group of us that are here today, talking about the reality of the spend, how much money we could spend on just filling gaps in staff. Staffing is a key part of that operational efficiency. Number 4, when we bring people in, there's often a couple of challenges. One is getting them up to speed onto our systems, into the flow more quickly. We don't have a lot of time to waste getting these folks ready to go. And then the other piece of that, of course, is that bringing these people in, it's important that they are up to speed on our approach to patient care and making sure that flow works well. And then, and I think it's important to think about how technology can be an enabler of all of these ideas, right? Most of these are not technology-only solutions. They can be really key enablers to driving a lot of these factors. And then increased compliance, credentialing accuracy. I mean, I cover credentialing for KLAS. Anybody of you who deal with credentialing will nod your head when I say it's an area ripe for disruption in a technology space. We've moved from huge Excel spreadsheets to better tracking and better credentialing solutions. But it's still a lot of there's still a lot of manual labor involved in that credentialing process. And it's certainly critical to us as we go forward. And then finally, thank you. Finally, just how do we think future? What's going to happen in the future, and how do we future-proof ourselves? So thank you. Let's skip to that next slide. So with these problems defined that we talked about, and there's many more that we could list, but I think that this list is a useful one. The question is, how can technology really drive results in some of these areas? You can't step outside the door these days without hearing about AI. And sometimes it's easy for us to start having our eyes glaze over when that topic comes up. But the reality is, and I think many of us are seeing, the use cases for AI are important. And that's actually how I really like to talk about AI is what is it delivering for me? It's a technology. It is not a solution unto itself. It's a technology that can lead to impactful use cases. So as we think about some of the trends that are impacting these areas, and I'm not going to read through all of these. I think I'll mention just at a high level. Predictive analytics, I hear more and more about. We hear about these huge data sets. Organizations are getting better at at gathering their data in a way that it can be used to make useful predictions. But then the question becomes, what technology do I use to do that? What problems am I trying to solve in those areas? And so how do I think about that? And I also, when we talk AI today, it's almost like we by default think about large language models like ChatGPT. AI is much bigger than that, from predictive to machine learning to large language models. And so thinking about specific use cases and then finding the right technology to help solve those use cases, I think is really important. A couple other things I'll mention. Certainly the mobile revolution is, if not, if you're not on it by now, it's kind of, it's a bit too late. But I think all of these pieces need to be really driven by mobile. And then I like that last piece around workforce engagement. And maybe even broader than that is just this sense of ownership of the workforce over their experience, over kind of the delivery of care, and just helping them feel like a part of the process. I'll maybe mention two specific technologies that KLAS is keeping a really close eye on, and then we'll transition into some of the other pieces here. But one of them is ambient speech. I think that's a really key area that's being developed, and a lot of effort is being spent. And you think about that in terms of hopefully a better experience for the patient sitting with a clinician who then doesn't have to take notes as they go. The notes are sort of being taken behind the scenes. But the reason I mention it in this setting is that workforce engagements piece. I mean, we're hearing reports of pajama time from physicians going down significantly. We're hearing spouses say, "Man, I am so happy about this new technology because I actually get my spouse available at night." That's not the only solution to workforce engagement, but we need to be thinking about these ideas. We need to be thinking as an industry about reducing burnout, about providing career paths that are meaningful, about helping people not feel overwhelmed. And that, charting is always a piece of that's a challenge. But it's more than that. It's helping people feel like a nurse feel like she has some control over her schedule, some flexibility around how she works. Perhaps the advancement of telenursing and opportunities for retired nurses to come back into the workforce and do some work from home. Thinking about those ideas, it's going to take a new level of thinking. And then the second technology I would mention, I think, is, and I've hit it a little bit, but there's a lot we know about what's happened in the past that we can use to help us be more intelligent in our decision making in the future. I heard an example from a CEO friend that was talking about, if there's this particular case and this particular nurse, we know kind of at this point what that experience is going to be like. We can predict kind of results and length of stay and who to best pair a nurse with a patient based on past experience. We can predict often length of stay in really useful ways that will help us prepare the next stage of the journey. We can predict the nurse load on certain days of the year or weather patterns. We can do things to make us more intelligent in how we use these scarce resources. So I'm excited about where technology is heading. There are tremendous organizations, and it's wonderful to partner with AMN because they're thinking about these challenges. And when I talk to AMN customers, they're viewing AMN as trying to address these opportunities in an impactful way. And it's an exciting time to be in healthcare IT, and I'm excited for the discussion we're having, because thinking about how technology can help us with these problems is probably key to solving them. So with that, I will end my thoughts for a moment and turn it over to Brendan, who will talk about a little bit of the next steps. Or sorry, maybe I'm going to Liz. I apologize.
Oh, no, it's okay, Niel. I'll jump in. But
you just went through this, Liz. I'm sorry.
It's okay. No, but you teed me up perfectly. I love all of the specific trends that Niel was mentioning, and I'm going to take a little bit of a step back and talk a little bit more about a framework and how you might think about the utilization of AI in your organization, or even when you're partnering with organizations like AMN or other technology platforms. These are ways to think about, where AI is being utilized, and then maybe if you're overweighted or underweighted in different areas where you can innovate. So nice to meet everyone. My name is Liz Cunningham. I'm our Vice President of Digital Solutions at AAs. We can interact with clients and clinicians and recruiters across all of our technology platforms, and leveraging AI is one of those tools that just really allows us to quickly iterate and innovate on new experiences. So if you think about these pillars, these are where you can start to look at, okay, where do I have a lot of utilization or tooling in AI, and where am I maybe underinvested, and how can I think about unlocking value? So the first one on the left around workforce productivity, this is actually where you see most of the use cases coming in play, right? So this is where you've got Copilot integrated into your, into your Microsoft stack, or you have ChatGPT that your team members are using, and whether they're using it in your stack or they're using it on their personal devices, your team members are using it. So there's a lot of tools out there being used around workforce productivity, specifically thinking around summarizing content, generating new content, things like that. This bucket's going to be interesting to keep an eye on over the next not even couple of years. I feel like you can't say couple of years in the AI space. It's couple of weeks and couple of months, but this space is where we're going to start to see and hear more about agency. So right now, a lot of the solutions and tools in the productivity space are all about kind of question and answers, right? You're prompting and asking a bot or asking AI to produce something for you. And where we start to see kind of that next generation is more on the AI agent side, where, tasks can be completed for you autonomously without you having to prompt. So that's a space for us to keep an eye on the workforce productivity side. As we move into automation and integration, this is about your processes and your workflow. Where are there tasks, whether it's in your back office or your middle office, like credentialing or time processing, billing, et cetera, that are repetitive processes that you can kind of have either AI bots and AI agents running for you in the back end, or where you can remove waste in the process. Also great use cases there around removing error. There's a lot of human error throughout our process, whether it's checking a timesheet against a schedule, checking a timesheet against an invoice, et cetera, that you can think about AI in those spaces. And then the two columns on the right are more about your actual products that you're using to interact with your customers. So when we think about digital products, this is where I think about the kind of end user engagement space. So Niel talked a lot about engagement with clinicians and just in general, how do we create a better personalized experience? This is the space where customers, so whether it's clinicians directly or patients directly, are expecting more personalized real-time experiences, and they're expecting more real-time answers and availability. So as you look at your products, and whether it's something you've built or partnered with, what are the investments you're making in this space around your digital products and interacting with your end users to increase that engagement? And then the last space is around your actual platforms. So if you're thinking about workforce management, look at your solutions like your vendor management platforms, look at your ATSs, look at your HRS systems, and look at what tools are in there to help your team members be more productive, but also to kind of increase and grow your business or increase speed of processes. So things I would think about in this space would be like the predictive analytics. Niel mentioned that a little bit, matching and scoring of candidates, teeing up insights into data, next best actions to create efficiencies in process, et cetera. These pillars are also a great way to think about kind of governance. So, there's some dialogue we can have later around AI risk and governance, which obviously is a primary topic as you're thinking about implementing or utilizing AI throughout your organization. And these pillars are also good ways to think about governing and how you have different policies applied to each ones and different tool sets in each one. So, as you think about your own internal AI governance frameworks, this is how AMN thinks about ours, is we operate in these pillars, and we have owners of these pillars and governance that runs across as we think about the different technologies that implement in each one. So when you look at the actual use cases and more common use cases around healthcare workforce management, we like to look at the specific implementations of AI around complexity, adoption, and then overall value. So, and you can think of complexity around risk as well. They're kind of synonymous in that space. But, just because we have something that seems like a good use case, a simple use case to try out for AI, doesn't necessarily mean it has the right value and outcome. So I think that's a common mistake we see, people wanting to just use AI for AI, but really not thinking about what's the overall value that it's driving. So this is an example of various capabilities we have in our platform and how we, looked at assessing which ones we should start with kind of first, second, third, and iterate on with our customers. So a great example of this is you see the large bill pay optimization bubble in the middle. So high value, Neil mentioned earlier, cost containment and using less contingent labor is on top of mind for all of our clients, right? So how can we leverage AI to actually embed various bill and pay optimization solutions within our products, whether it's making recommendations on rates based on availability of clinicians, likelihood to fill, location, et cetera. And then how can we actually continuously use that data to further plan in the future of what, optimal rate mix or spend would end up looking like. So, that's an example of something that is medium complexity, large value, but interestingly enough, had really low adoption. So there's different levers you can pull. So you can create a model, you can have this great data set, but if it's not maybe embedded in your platform in a way that an end user would use on a day-to-day basis, you've built this great thing that no one's actually using and creating that value. So in that green bubble example, that might be a strategy that you look at and say, okay, hey, I'm actually really going to focus on where am I utilizing this in the platform? How do I train my team members on where to use it? Or as a product person, did I embed this in the right place in the product, and how do I continue to support that utilization? Another example would be credentialing. We've mentioned credentialing a few times, but credentialing was actually one of the first spaces that we really started to focus in on leveraging AI, because there's so much documentation review, so many different sources of data for verification, and it's a very kind of data-rich area that you can apply a lot of AI principles to make it more efficient and effective. But it's also highly complex and high risk, because you have to be, verifying specific documents and acumen of a clinician, right? So that would be an example of something where you could put together processes, you could put together verification processes, but you might want to have a human at the end of it still doing the final check, right? So there's kind of that partnership between the human element and the AI element. And then on the flip side, in the, purple bucket there, candidate communication, right? That's a great low risk area where, customizing job matches or job recommendations to a future candidate via SMS, right? It's pretty low risk. If the match isn't exact, they can give feedback that that's not what they're looking for, and you can adjust the model. That would be something that you would push to iterate on quickly and try to get something out from an MVP perspective. So just different ways to think about all of these different trends you're hearing, and how you as an organization can have a model in place to appropriately govern, prioritize, and then implement and iterate on your AI use cases. All right, so with that, I'm going to turn it over to Brendan.
All right, just coming off mute here. Thank you, Liz. Brendan Stack. I lead a product team here at AMN Healthcare covering enterprise clinician scheduling and workforce analytics solutions. So, I get the privilege of going out and talking to customers and figuring out what the cool new use cases are and how we can incorporate those into solutions that we offer to our customers. So Liz talked a lot about different use cases to where you may not realize that you're already using AI, right? You have a partner in AMN or somewhere else. They're building AI into their solutions, right? You're getting the benefits of that today. I'm going to talk about two more use cases that you're probably or maybe using today without knowing it. And really the idea is just to normalize AI, right? It's been around a long time. It continues to evolve, but the more comfortable we become with it, the more we can apply it and gain benefits in our enterprise. So the one that I always like to use as an example is an applicant tracking systems, right? Resume sorting. This has been around a long time. I would wager that virtually everyone on this call has had some experience with automated resume software, right? Of course, it always rejects the qualified candidates before they can get to the eyes of our recruiters. I only joke somewhat about that, but that's one thing where it's used extensively by virtually everyone. So whether you apply for a job or whether you're a leader hiring somebody, you have touched a solution that uses AI, right? Another one that we pioneered within AMN and that we continue to iterate on is in predictive analytics in scheduling software, right? So what good is being able to deploy a flexible workforce throughout a very large health system if you don't have a clear understanding of what your patient demand is going to be like, 2 weeks, 4 weeks, 6 weeks, 6 months down the road, right? So those are just two more examples of where you're probably using it today. What you're seeing here are some of the more burgeoning use cases, ones that we're investigating or that are being implemented in solutions across the industry. I'm not going to go into all of them. I'm just going to highlight a couple of them. So they range anywhere from being tactical solutions to strategic workforce solutions. So one that I want to call out is predicting shifts prone to call-offs, right? That's something that we can do today, where you can look at all of the factors that are going to lead to somebody not working a shift. We all know how painful it is when somebody calls out, right? You have to mobilize resources. You have to contact a central staffing office. They have to go through their list of who's likely to work and maybe offer some under the table incentives. It's a whole thing. Very time consuming and taxing on an organization. And an organization with tens of thousands of clinicians, this can happen dozens or hundreds of times every single day. So you can use AI to predict that ahead of time. And going beyond that, one thing you may have heard, kind of a buzzword in AI these days, is AI agents, right? So we can take that information about who is going to call out. We can create autonomous programs that will look for those opportunities and then automatically contact a person who has the right skill set, who's available, and who is likely to work in that situation. Nobody even has to know that a call off even happened. The right worker just shows up, right? Another one in the same vein is turnover, right? We've got a white paper coming out soon. We'll be sure to get that over to everybody here once we publish that. But we looked at tens of thousands of instances of employee turnover using AI. And we identified all sorts of facets of information contained within scheduling practices that are going to lead to somebody terminating, whether that's their choice or the choice of the employer, right? And we were able to identify not just those aspects that are going to lead to it, but in what degree. For example, we know that people work in healthcare tremendous amounts of overtime, right? But how much overtime is going to indicate that somebody is going to terminate or is at risk to terminate? Same with time off. People call in, how much calling out or even scheduled time off is going to indicate that somebody's going to turn over. So we can put all of these together and come up with a model that says that a person is likely to turn over. Going beyond that, we can then take that information, pair it with the predictive analytics around patient demand, and create models for the future of what our workforce needs to look like, right? So we can look at, say, 2 years, 3 years, 5 years down the road and understand, are you going to add a service line? Are you going to acquire a new hospital? Right? We can factor all these things in and make strategic plans for what your workforce needs to look like. Okay, so that's just some of the use cases that are really under development or throughout the industry that I wanted to cover. And I think that one of the things I want to highlight that myself, Liz, and Niel have really talked about is AI is here. Niel said your eyes probably glaze over when you hear AI, right? It's ubiquitous. So what is it that is preventing us and you from adopting it today, right? Liz, if you want to go to the next slide. Right, there are some very real reasons that we may not have chosen to move forward with AI use cases. There's ethical considerations, there's privacy considerations. We all know as healthcare professionals how critical it is to protect our patients' information and how damaging it can be to our reputation if that information gets out. So I'll give you an example of one of the things that has happened simply by employees using large language model type AI in their enterprise. Last year, Samsung banned the use of ChatGPT within its organization because somehow some internal proprietary code escaped through an employee's use of it, presumably to come up with some kind of answer on how to improve that code. But it was publicly available for anybody to see, and there's no getting it out, right? There's no getting it out of that large language model now, and this is a very real problem. So something we need to be aware of. Another thing that we need to think about is bias and discrimination, right? The more that we use AI to make decisions for us, the more we have to understand we factor in, or at least we try to, when we make decisions, that bias can happen. And so we need to account for that. With AI, it's only so good as its underlying data, right? So if there's biased data underneath, the outputs are going to be biased as well. So really think about that. There was a study last year that looked at image generation software, right? Over 5,000 images analyzed, and it showed that it amplified gender and racial stereotypes, right? That's all just based on the data that fed that model. So another thing that we need to be really careful about, and again, why we think about putting pause on some of these really great ideas and use cases. So overcoming implementation barriers, right? What is it that makes now the right time for AI? It's old science, right? Neural networks have been around for over 50 years. What makes now the right time to do some of these use cases that we've just talked about? You remember Watson from IBM 15 years ago, right? Very ahead of its time. Great tool still. The thing that has changed is that organizations have moved more towards having data lakes, having pipelines from their enterprise applications into all these services. There are built-in services in the public cloud applications that allow you to, at the click of a button, deploy these AI tools, right? So all of the stuff around the old science has enabled it to make now the right time to be adopting AI. Finally, there's a whole new problem. It's hard to say where this fits in. Again, it's a sort of ethical, sort of privacy, but it's really when we think about choosing use cases for AI, one of the things that has become very prevalent is something called hallucinations, right? And that's where an AI LLM simply manufactures some information out of nowhere, right? So one of the most successful current use cases of large language models in healthcare is in transcription, medical transcription, right? Already very high adoption, showing great promise. But there was a study by Michigan University last year that showed one of those tools had hallucinations in 80% of all recordings, right? I mean, that's a huge number. So you have to balance that risk and understand what it is that you're getting into before you go forward with your use cases. So those were just some of those aspects. Before we go on, I just kind of want to leave you with really the two takeaways of spend time on figuring out your use cases, right? The technology is there, the partner ecosystem is there, your vendors are applying AI in their solutions. Where you're going to get the most bang for your buck is defining what use cases are going to benefit your organization Number two, clear guidelines for use for your organization. Talking about that Samsung leak, that likely wouldn't have happened if that organization was prepared and had deployed guidelines and tools throughout the organization to preempt something like that happening. So we'll pass it back to Mariah for any Q&A. And thanks, everybody.
Perfect. Thank you so much. And thank you all for that excellent discussion. As stated, we will now begin today's question and answer session. Again, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. So let's get started with the first question. Team, the first question I have for you is, how well would the predictive AI tools be for a small critical access hospital without large data sets to feed the model?
I'll start and then would love everyone else's thought. And so, there's two sides of that coin. I think one side of it is, yes, the larger the data model, the more helpful they offer, or more accurate, perhaps I should say, they often tend to be. However, I do think that also the more niche that something is, then the more the opportunity is for that predictive analytics to be helpful. For what I mean by that is, if a critical access hospital is overstaffed by 2 nurses, that has a lot bigger impact on them than perhaps a large system who's overstaffed by a couple of nurses. And so I think there's real opportunity for this technology to be impactful in those spaces. I think that one of the things we're going to have to do as an industry is think about how we build large data sets ethically, but that's going to take some collaboration. Like I do think we can learn something from saying, I'm a critical access hospital in rural New Mexico, and I'm one in Arizona. We're not the same, but there's a lot of factors that impact us. Perhaps some sharing of data could be impactful for making that data more impactful. I think we have to be creative about those, but I absolutely think that in some of those smaller niche areas, the impact can be significant because the challenges are real, and also any bump in improvement really drives a significant portion of improvement around margins and efficacy. Any other thoughts from the group?
Yeah, I might add one more, Neil. As Ryan, if you're looking at either purchasing or partnering a solution on whether it's scheduling or vendor management, et cetera, if you are in a small rural hospital with a lot of data, that would be something I'd be asking your vendors, like, hey, does your platform make available or neutralize broader market trends, broader market data that I can leverage? So I would say most platforms out there do have some sort of like market assessment that you can use to benchmark yourself and be part of the data source in the AI model, right? So it's not just a closed model based on your tiny set of data. So that would be something I would really be asking your vendors if you're looking for a solution in that space.
No, I think that's a great point, Liz. The ubiquity of AI as it's coming up really helps with that, just because there are going to invariably be those scenarios that have already been figured out, right? You don't have to necessarily be the pioneer of that, where your data is the only data that's available. All of your vendors are going to be very eager to gobble up this information and use it for their benefit, and that translates into benefit for you. So I think that there is that definitely opportunity to use that benchmarking or previous research to, at least right out of the gates, help out with AI solutions that can then over time learn better towards your specific needs.
Yeah, perfect. Thank you to the three of you for answering that question. And kind of a follow-up question also from Ryan. Is adoption equated with the cost?
Yeah, I can jump in on that one. So I think, Ryan, you were referring to that bubble chart I was showing. And I'd hate the answer, it depends, but it does depend on the utilization, right? So if you're building a model yourself, right, you're custom building a model, you're in charge of the data storage, you're in charge of paying for the GPUs, like, yes, the adoption theoretically would lead to more cost of the model. But I would say most of the maybe workforce management use cases are embedded into platforms you either already have or you're looking at purchasing in the future, and that cost should be accounted for in that platform and how you did that contracting. So, an example is if and I'll just keep using vendor management. You have a vendor management solution with predictive bill rates in it. My assumption would be that's part of the cost I'm already paying for the platform, right? I think most platforms these days you should assume have embedded AI capabilities, and the growth of adoption wouldn't necessarily, impact the cost there. There are other models depending on, the platforms that you're looking at, like a CRM, for example, where, yeah, you do have to buy an additional license if you want to leverage, certain AI agent capabilities. So I think it depends on the technology you're looking for, and if you're building, buying, partnering, et cetera. That'll change the cost of whatever utilization you're looking for. Is that Neil? Do you want to add anything to that, or Brendan?
Yeah,
sorry, go ahead, Brendan. You go ahead.
I was just going to say, I think that that distinction is very important around building your own model versus using a technology partner or vendor or solution that has pre-built it into their platform, right? The arms race of AI across the industry is only going to benefit you in those cases, right? You're not going to have to worry about those costs being passed on for the most part due to the tremendous competition that is out there amongst technology vendors and their need to differentiate themselves. So yes, it can, as Liz said, equate to increased cost. If you have your own data science program, if you want to take, your proprietary information and really, do some specific things unique to your organization. But for the most part, every application under the sun out there that you're going to use to help your enterprise is going to embed it, and not really at significant increased cost to you.
Yeah, the only thing I would add is that I think at the specific level, great answers. I think like a lot of the vendors I work with, they're trying to figure out the answer to this very question. If I build all this AI technology in, how do I meet the needs as well as make it a kind of an economical model for my customers? And so just to echo the point that Liz made very well, just have really clear conversations with your vendors about what's your roadmap in this space, and what does that model look like for us from a subscription standpoint going forward? Because I think honestly, a lot of folks are still trying to figure out exactly how that looks.
Yeah, absolutely. Thank you so much to all three of you for sharing that insight. Another audience question that just came in asked, you have mentioned the technical challenges of using AI tools, but what have been some mindset, psychological challenges in getting employees and clients to adopt some of these tools?
I'll take that one.
Go ahead, Brendan, go ahead.
This is a really interesting one. Because there's been a fairly recent sea change, really, with how prominent AI has become in just public discourse. So previously, we saw reticence throughout the healthcare industry to really embrace automation of any kind, whether that's AI-driven automation or more traditional robotic process automation, things of that nature. What we've seen is as the solutions have become more available, and as individuals through organizations, like I mentioned in Samsung, right? When there's grassroots desire to use these kinds of tools and enthusiasm for it, the culture change happens organically, right? So we've actually simply seen, in general, a shift away from that reticence to where products were trying to drive that and convince customers that automation was, the wave of the future and that you needed to adopt, to now that being a demand of solutions. So I think that is something that is just naturally occurring, and it's really now more about corralling that mindset of individuals who want to try something cool, want to try something new. Hey, I've got an idea, right? And you have to provide those guidelines and tools that are approved by your compliance departments, approved by your legal and infosec departments, right? Because again, the risk now is less about falling behind and more about what damage can be done because of how easy it is to adopt some of these solutions. Anything to add, Liz or Niel?
Yeah, no, I think that's a good example. I would just add maybe a little bit more like specific examples from what I've seen. Like if it's embedded into a day-to-day workflow and a technology that someone is using, and it's right there, like the adoption's going up. I think where we see some struggles in adoption are when you have these like bots on the side, which I know is an easier way to iterate for some organizations. So, I'll give you guys a great example of one that we actually did. We built a bot like embedded into Teams where if we get a job description for a clinician, we can go get it updated really quickly and add in different skill sets to match keywords, whatever, to get more reach, right? So, we thought it was a great idea. We put it in Teams, everyone has access, and like no one uses it, right? Because they have to leave the ATS to go into Teams and touch the little bot and then put it back in. So, there's ways you can innovate and, I guess, yeah, you can innovate quickly with things like that, but you won't see the adoption until you're actually like putting it in the operating reality of the person. And I think we have to realize with healthcare professionals that they're using so many tools throughout the day in so many different places that just adding another one doesn't necessarily always, add the benefit, whether it's AI or just another tool. So think about that embedding into the operational reality, once you pilot something and kind of iterate on it after that.
You actually said almost exactly what I was going to say. And so well said. I think hopefully over time, the question is not how do we adopt? It's very naturally adopted. The question is, what's the strategy? And then what's the governance around it to make sure that we don't have any breaches that Brandon laid out. And so hopefully we can shift that discussion. It's so naturally embedded that it's not about adoption. It's about kind of making sure that the structure's in place.
Yeah, definitely. Great advice. The next question that someone asked in the chat, my biggest issue is around data security. How much can I trust any data provided does not end up in the quote wrong place? Liz, did you have anything to kind of share there?
Yeah, I can start. So, I mean, one of the, if you look at all of the various governing principles that have been put out there, whether it's by, the Health and Human Services Department, specifically around healthcare, or just our, general US policy, it's all around transparency, explainable data, non-biased data. So any platform or solution you're looking to partner with, they should be able to provide you with, and you should be asking for all of their policies as it relates to the data they're using for AI, what access you would have to that data, how you can see how the models are built, et cetera. So in any RFP, any solution you're looking for, ask those questions, and then be looking for partners that, view data security and data privacy, in as high regard as, you all have to in healthcare. For example, like at AMN, we've got a chief information security officer, and we have, SOC 2 type 2 compliance certifications across all of our platform. And that's our way to make sure our clients know that, we treat data security and data privacy as a top priority across AMN. So I would just be asking the questions and make sure you see the policy and make sure that they're being transparent about the model and the data being used. It's your right, if you're using it, to understand that data and understand how they're preventing bias, et cetera. Another kind of guardrail that we like to look at is sometimes the EU is a little bit ahead of us in terms of having stricter policies. Even if you think about some of the current policies around like cookies and things like that, they're ahead of us and we're kind of trailing. They recently just put out their AI Principles Act that has like different levels of risk associated with various use cases. I think it's a really good benchmark to go look at how you assess your different use cases and how you make sure you have the right policies in place. I think, Ryan, you asked a question about some of those policies. So we like to look at that EU AI Principle Act, and then, there's other ongoing changes happening every single day at the state level. So, just keeping an eye on all of that and continuously asking your vendors on their policies and how they're adhering with those.
Yeah, I think that the only thing I would say is, ask really good questions, but any vendor that you're working with in the AI space should have really clear answers around a couple of major items. And maybe not answers. They should be proactively telling you. One is, this is what we do with your data that we use to make the prediction. This is how it's treated, what we do with it, what it's combined with, who we share it with, all those questions. The second one is the prompts. I mean, that's the point that Brendan made, is that some of these models take the prompts that your organization uses, and that this is more for large language models and other areas, and take that and turn that into training data. So understanding what happens to that data that is used in prompts, for example, or if you're building job descriptions, if I lay out my job description, where does that data go? Is it just is my model trained on it? Are other models trained? Just make sure those two questions are really clear in your minds, among others that were laid out well by Liz.
Yeah, that definitely makes a lot of sense. Another question that came into the chat, someone asked, can you share an example of a healthcare client of yours who achieved cost saving and improved operational efficiencies through the implementation of AI-based workforce solutions?
Sure, I can give a couple of examples. A couple of the use cases I mentioned earlier around turnover, right? What do you do with turnover? So we all know it's a challenge. So how do you prevent that? If you identify the behaviors, traits, practices that are going to lead to that, well, then you can take active steps to reduce that. Any reduction in that turnover is going to lead to direct cost savings. So one of our clients, UAB, academic medical center, we were able to reduce their turnover by 6.6%, right? Huge amount of savings through various practices, just going all the way from our predictive model and our scheduling software, and making sure that resources actually align to demand. And make that's a huge driver of staff satisfaction. Just being able to be staffed appropriately to how many patients that you have. So that, combined with the identification of those elements and a number of other things that we do with strategic workforce planning, led to over $3 million savings for that client. So there's very real, tangible savings to be had.
Great. Thank you so much for sharing that example. Another question that came up talking about AI. What are some of the principles of AI governance, and what have you seen be successful?
I can go first. Liz and Brandon, you've probably seen these in action. I get this question a lot from healthcare providers. But I think the one caution that I would give is that sometimes governance can cause you to move too slowly. And so there are principles of governance that matter. But I would also caution to say the value in these technologies is in the adoption. So think of governance as an adoption strategy versus a limiting strategy, if that kind of paradigm makes sense. But within that, you have to be cautious. You do have to be smart, and you have to decide, how broadly are we going to adopt this? How are we going to approach our data? That may be the number one thing you need to think about. Like with our data, how are we going to allow access to that to our partners, to let them learn from this data? And there's some discomfort in that, but really open conversations with vendors about that topic are important. And I'll turn over to you, Liz and Brent. I'm sure you have some practical examples, but I would just say have governance, but have it be in service of what you're trying to achieve, not in hindrance of it.
Yeah, I think the big thing with governance is really, in addition to providing guidelines, is providing outlets for your employees to use the technology that has infiltrated their day-to-day lives, right? They're going to want to use these things in their workplace because they're using them at home. And so if those outlets aren't provided, this is another area where shadow IT can develop in an organization, where because of how easy some of these technologies are to acquire and make use of, they can become embedded into the organization in ways that are hidden or obfuscated from the IT department or information security, and that's where the risk really comes into your organization. So on Niel's point, don't slow things down too much. Make sure you're providing the guardrails, but providing those outlets for your employees quickly.
Yeah, I think if you look at your organization and just look at a couple of things, right? Do you guys have a policy? Like step one is, do you actually have a AI policy in terms of internal utilization, right? So I would say ensure you've got a policy, so you have a position as an organization. And then, I know sometimes the words like governance council can be daunting, but just to give you guys some ideas, we have like a quarterly governance council that's got someone representation from legal, risk, IT, information security, and the business. And all they do is every quarter they're reviewing kind of new proposals or utilization. And then we also have an actual review process where you govern the actual technology that the use case wants to use, the model itself, and then how it's going to be applied in that application. So there are principles you can put in place, but then you can fast track based on that risk scale, right? So something that's low risk, it's like that should just be a fast pass, right? You want to try to, this sounds like a tiny example, but you want to try to dynamically, populate a subject line on an email based on where that person's located. Like that's, auto approve. But if you really want to start to go look at, doing some more natural language processing and prediction around maybe like time cards against pay, like that might be higher risk, right? Because that's on the employment side and that might need to go through different layers. So use that risk profile, like I mentioned a couple of times, to determine how quickly you can iterate on some of these examples.
Perfect. Thank you so much for answering that question. And unfortunately, that is all the time we have today. But I do want to thank our speakers, Niel, Brendan, and Liz, for an excellent discussion, and AMN Healthcare for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on our webinar console and fill out the post-webinar survey. Thank you again for joining us, and we hope you have a wonderful afternoon.
Thank you.